Let's clear this up once and for all. Where does the science rest on this? Does wearing a mask actually significantly reduce infection?
Yes, it does, Richard. Absolutely. Although I will say that the guidance has changed because the science has changed. Back in January, February, we didn't know as much as we do now. For example, about asymptomatic transmission, that now we know up to 50% of cases of COVID-19 are transmitted by people who are not showing any symptoms at all. We also now know about aerosol transmission, that it's not just sick people who are coughing and sneezing and transmitting through respiratory droplets. It's also now these microscopic droplets that you just expel by breathing and speaking. So that's why it is that we need to be wearing masks. It protects ourselves, it protects one another. A recent Lancet study actually found that if we all wear masks, it reduces the transmission of COVID-19 by up to 5 times. So think of it like a medication, that if we took a pill that could reduce the risk of us getting COVID by 5 times, we would all take it.
Doctor, we are seeing numbers, you just heard those reports, you were seeing numbers rise pretty much everywhere where there's a lockdown. The reality is we can't keep economies locked down, that it's simply not possible. We'd end up with economic catastrophe. So, are we just resigned to these rising numbers? Wearing a mask may knock it down a bit, but actually this virus is just going to be playing chicken with us for a long time.
Well, I think the best way to look at it is that this is a very contagious virus. It is going to spread from person to person when given the opportunity. The key is we have to suppress the level of infection low enough in the community and also ramp up enough of the testing, contact tracing, other public health infrastructure so that we can rein in the infection. So we do have to follow these interventions like wearing a mask, washing our hands, keeping physical distancing.
But even if we do all that, if we open our economies, which we're a business program here, so we talk about these things in hard terms, even if we do the mask, the social distancing, all these other things, will we bring the virus sufficiently under control?
Yes, we can. And this is why I'm glad to be speaking to you here, because so often public health is somehow framed as the enemy of the economy, when actually public health is the roadmap back. We need to be able to keep the virus under control, have the public health infrastructure to do so, all of us doing our part with something as simple as wearing masks. And if we do that, that's what's going to allow people to come back to work safely.
Okay.
That's what's going to allow schools to reopen. And so we need to look at this as working hand in hand with basic public health measures.
Doctor, you may find this next question, well, a little almost offensive, but you'll know what I mean. When the president of Brazil says people are going to die, that's just the way it is. Will we come to a point where that is the choice we have to make? We cannot keep economies locked down. It's simply not possible if we wish to keep civil society and we wish to keep society in any form of structure. Do we need to accept people will die?
People will die because of COVID-19, but the question is, how many deaths are we willing to accept? If we know that there are simple measures that actually allow the economy to come back sooner, that also prevent death in the process, shouldn't we be doing that? There are a lot of effects, economic downsides to reopening and then shutting down, reopening and then shutting down. Why not do it right and get the capabilities, the testing, tracing up and running? That's what countries, for example, many European Union countries have been able to do this successfully. Why can't US, Brazil, and others follow the footsteps of what's already been effective?
Doctor, good to have you. Thank you.